Good morning, everybody. I would like to share with you and mainly brainstorm a little bit about some of the findings we have in our study regarding fear of dementia. I will share the presentation with you. Great, I hope you can see it. And we'll start. Surveys conducted during the last years reported dementia being the second most feared disease after cancer and after stroke sometimes. In the last decades, however, some studies show that dementia is the very first most feared disease. In Israel, a survey we conducted, we found that it is the third most feared disease. Fear is also a central component in cognitive models, such as the health behavior model, in which it is found that fear prevents people from seeking help for cognitive problems. It's also part of stigma models, in which it was found that it increases negative stereotypes, negative emotions, and discriminative behaviors. So our question is, what is dementia fear? The truth is that there is not very clear and uniform conceptual definition of this term. The first one to define it was Cutler, and he called it anticipatory dementia to express the fear that people feel that in the future they will suffer from cognitive deterioration. Afterwards, the terms of the worry, fear, concerns, anxiety, and anticipatory dementia were used interchangeably. In 2012, Kessler and her colleagues were the first to provide a more clear and structured definition of dementia worry, and it was defined as a response to a perceived threat. When fear was the emotional dimension of dementia worry, and it was found or defined that it can vary in intensity from mild to severe. So our research question was, what is the understanding and the role of fear in early predictive diagnosis of dementia among different stakeholders? To answer this question, we decided to explore and characterize the fears provoked by early predictive diagnosis of dementia among laypersons, persons with mild neurological disorder, and their relatives, using a cross-national qualitative approach and basing on focus groups that were conducted parallelly in Israel and in Germany, using a similar interview guide and the presentation of vignettes. We use thematic content analysis to analyze our data. And here are our findings. Participants use terms varying in intensity, such as fear, worry, and even shock, to express the frightening emotions aroused when confronting the possibility of developing Alzheimer's disease. We were able to identify 4 sources or triggers of dementia fear that were present in all the groups and in both countries, and a 5th source that was present only in Germany. Regarding cognitive deterioration, prospects of cognitive decline were mentioned as one of the main reasons prompting feelings of fear and despair, and participants refer mainly and mostly to memory problems. Notions of dementia as an incurable and untreatable disease were also associated with profound feelings of fear, as was family history. Having a close relative with dementia, usually a parent or a sibling, was also associated in all groups with feelings of fear and worry. This was not based on a deep understanding of the increased risk associated with having a family history, but rather on having vaguely heard about what they call this genetic thing. Knowing a person with AD familiarity was also one of the sources of fear of Alzheimer's disease, and especially if this person was acting aggressively or out of control. Finally, fear of losing self-determination or of losing autonomy, as I said, was present only in German, and it expressed deep worries about the prospect of losing the right to self-determination, to being manipulated, to having someone taking care of their needs and of their wishes. Let's see some of the quotations for these themes. Cognitive deterioration. It's my worst fear that I will not know what is going on with me, that my brain will collapse. No cure. Cancer can be cured sometimes. That's what scares people, that if you get sick with dementia, there is no turning back. There is no cure. It's a one-way ticket. Familiarity. When I see my friend with dementia, I am terribly afraid. And finally, a family history. If you have someone in your family with dementia, you realize that there is something that also increases your chances and losing autonomy. What scares me is the idea of getting manipulated, no longer being able to do what I think is right. In addition to these sources or triggers, we found the consequences of the fear of dementia. We found also negative consequences, such as anxiety and stigma, and positive consequences, such as optimism and risk reduction, what we call bad fear and good fear. Regarding anxiety, many of the participants expressed that early predictive diagnosis can only bring up anxiety, depression, despair. Regarding stigma, participants mainly worry about what others would think about them if they developed Alzheimer's disease. They particularly emphasize the fear of being secluded by others, including their loved ones. Regarding optimism, many of the participants describe situations in which they suggest to deal with the fear of developing the disease with optimism, with humor, and just living the day as it is and seeing what life will bring. And finally, engaging in preventive measures. Participants in all groups voiced the possibility of managing the fear and shock aroused from anticipating developing dementia by being involved in activities which might, in their opinion, decrease this risk, such as physical, social, and cognitive activities. Let's see some quotations. Besides anxiety, EPD doesn't do any good. The person worries about those around him, friends, worries that others will notice that something is wrong with him. Regarding preventive measures, it's scary, but the earlier you know, the better you can prepare yourself for it. And finally, optimism. Some people are going to take it to their hands and will say, well, I'll keep living. No matter what, I'll keep living. So if we summarize, This was the first qualitative study using a diverse multi-stakeholders binational approach to try to understand the complex concept of dementia fear. We found that dementia fear is present in the life of all the groups in both countries, and we were able to identify important sources and consequences of dementia fear. So how can or should this knowledge contribute to developing interventions to increase early predictive diagnosis? Obviously, what we have to do is to increase the good fear while decreasing the bad fear. Fear is commonly used in public health campaigns. We don't have to go very far away, but during the COVID-19 crisis, almost all the countries, the very first campaigns they used were based on the fear factor. And after a while, and when they saw that it doesn't work, they tried to correct it. Indeed, there is a big debate, ethical and moral debate about the use of fear campaigns. So what do we need? Maybe we need a model. Maybe we need some more structured guidance to develop interventions. And indeed, we have several models available, like the health belief model, the extended parallel process model, but we are missing something in this model. What is that we are missing? The moral and ethical implications. So dementia fear is a multidimensional and complex concept with different and even contradictory consequences. But what we need is to define its moral, ethical basis before moving into the development of interventions. How to do it? Our symposium might be the first step, and let's hope that tomorrow we'll be able to answer this question much better. I just want to show you some of our collaborators, and since you can't come to Israel, I would like to leave you with a picture of our beautiful university. Thank you very, very much.